I'm going to go over another viewer-requested topic today, and that topic is traumatic brain injuries, or TBIs as they're known today. And I'm going to talk about what sort of traumatic brain injuries we see, and what sort of disabilities they can cause, and how they're evaluated and qualify for Social Security disability. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, the viewer's question was basically, does everyone with a traumatic brain injury qualify for disability? And the answer is definitely no. However, there is a section in Social Security's listing of impairments on traumatic brain injuries, giving the criteria necessary to qualify if that's the only problem a person has, and I will be going over that. So, what sort of injuries do we see? What comes under the heading of TBI? Well, basically, medicine divides brain injuries into two types, closed and open, and the closed and open refers to the head. A closed head injury is where the head bumps into something and injures the brain inside the skull. An open head injury is where somehow or other the skull is penetrated and the brain is open to the air. That can be, for example, due to a gunshot wound or a stab wound that goes through the skull, or a bad skull fracture with a laceration of the scalp, such that the brain cavity communicates with the air. Head injuries can cause all sorts of problems to the brain. Everything from a mild brain shakeup, which we call a concussion, to bruising of the brain, where the brain actually turns red and then green and yellow and purple, just like a bruise in your arm, and then gradually heals up, to a laceration of the brain, where the brain tissue is torn like a cut, to bleeding inside the skull due to tearing of some of the blood vessels in the skull that causes pressure on the brain, and the pressure damages the brain. And if you find this sort of thing interesting, you might want to subscribe to my channel. I generally put out one disability-related video every week. The problem with the brain in the skull is that the skull is a closed box with only one opening at the back where the spinal cord comes out. And if there's too much pressure on the brain, unlike the stomach, for example, which can swell up and expand to accommodate an increase in pressure, the only way the brain can react to pressure is being squeezed like toothpaste out that hole in the back called the foramen magnum. And the part of the brain that gets squeezed through that hole contains the part of the brain that controls your breathing, that makes you breathe in and out. And when it gets squeezed too hard, the person stops breathing, and then, unless they're put on a ventilator, an artificial breathing machine, they die. So I want to talk a little bit about how I evaluate someone who tells me that they've had a traumatic brain injury. And the first thing is, I want to know in detail what happened. Was it an automobile accident? Did they fall? Were they hit on the head with something? Were they exposed to an explosion, as is common in the military at war? The next thing is, was there loss of consciousness? Were they knocked out? And if they were, for how long? I generally divide that into 3 groups. The first is a person who's knocked silly. They're not completely out. They're confused. And I've seen this when I've worked as a ringside doctor for fighting sports. Twice I've seen a fighter get hit in the head, still remain standing, but be confused and think they were fighting the referee. The second is knocked out completely knocked out, but for less than 5 minutes. And the third group are knocked out for more than 5 minutes. And most people who are knocked out for more than 5 minutes will remain knocked out for quite a length of time, hours, days, or even weeks. The next question I ask is, did they go to the emergency room? Now, people who don't work in the emergency room think that every patient in the emergency room is critically ill, and that's very far from the truth. In fact, the majority of people seen in the emergency room have minor problems, and that includes the traumatic patients, the people who've been injured. The majority of people brought in by ambulance from car wrecks have minor bruises and scrapes, not life-threatening injuries. So if they were seen in the emergency room, were they sent home or were they admitted to the hospital? If they were admitted to the hospital, were they admitted to a regular bed, suggesting that their problem was not life-threatening, or were they admitted to the intensive care unit, which suggests a much more serious problem? Next, did they have brain scans? For brain injury and head injury, the best scan to do early on is a CT scan, because a CT scan is excellent for showing skull fractures and for showing bleeding in and around the brain. An MRI is not the best test early on for a brain injury. It's bad at showing skull fractures, and it's bad at showing acute bleeding. An MRI is useful further down the line to show long-term brain damage. What did the brain scan show? Did it show a skull fracture? Did it show bleeding in the brain or bleeding around the brain? And did it show air in or around the brain, which is called pneumocephalus, which you can get from an open skull fracture? Did the person require neurosurgery? Did they need brain surgery? And if so, what was done? Were there associated injuries? In particular, if someone's been in a car accident where they got injured bad enough to have a serious brain injury, the doctors need to make sure that the neck wasn't injured as well, because broken necks and bad head injuries often go together. Were there other serious injuries that may have resulted in permanent impairment, such as injuries to the chest, the abdomen, the arms, or the legs? And what problems have persisted? Remember that for disability, the initial problem is not what counts. What counts is what has persisted, because for disability, Social Security wants to know, is the person able to work now, months after the injury has happened? With serious head injuries, a person may be permanently disabled when it comes to memory and thinking. And here, having a family member or partner who knows the person well can be very helpful. As I've stated before, when I do have someone who has problems with memory or thinking, I like them to try and give their medical history to me first, because then I can actually see and evaluate how well they're remembering, thinking, and speaking. If it's obvious that they're having trouble and they can't answer certain questions, then I'll ask their family member or partner to supply me with that information. And I'll also often ask the family member or partner to tell me what they think of the person's memory or thinking, both before and after the brain injury. And when it comes to that, it's important to know what was the person's prior education and their job. Did they have an elementary school education, a high school education, or a university education? Were they doing simple manual labor, complex labor, such as working as an electrician, or were they doing intellectual labor, such as a university professor or writer? So, brain injuries can cause all sorts of permanent impairments, and here are ones to consider. Is there an impairment of the vision? I've seen people blind in an eye from a head injury. Is there impairment of hearing? I recently saw someone who had a bad head injury that had had a skull fracture that had gone through the inner ear on one side, rendering them deaf in one ear. Do they have trouble with speech, smell, feeling, strength, coordination, thinking, memory, and emotions? People who've suffered severe head injuries often have what we call emotional lability. Like a child, they have difficulty controlling strong emotions. A previously calm and well-controlled man, for example, may scream or cry when upset or frustrated. A particular problem that's sometimes seen after head injuries is seizures or epilepsy. Some people will have seizures immediately after a head injury in the first day or two, and most of those folks will not have subsequent seizures. But some people, especially people who've had tears of the brain that result in scarring, may have a seizure disorder that's persistent after their head injury. And a severe seizure disorder can qualify a person for Social Security disability. If the person does have seizures, we want to know what sort are they, and that usually requires asking a friend or relative to describe them, because the person's usually unconscious during a seizure. How often are they? Are they on anti-seizure medicine? And if so, how effective is it? Or what all medicines have they tried? And are they sleepy or confused after the seizure stops, which is called a postictal state and is common. So, what does it require for Social Security to qualify for disability based on a head injury alone? This assumes that the person has no other disabling injuries and no other disabling illnesses, such as heart disease, for example. Well, the easiest way to qualify is pretty bad. If you're in a coma or a persistent vegetative state for more than 1 month, you qualify for Social Security disability. If the person's not comatose or in a persistent vegetative state, Social Security wants them evaluated at least 3 months after the head injury, because most head-injured people will improve gradually after the injury. What they require is either severe disorganization of the ability to stand from a seated position, to balance while standing, or severe difficulty walking, or severe difficulty using both hands or both arms, or less severe physical limitations with included mental limitations. And these include limitations in the ability to understand, remember, apply information, interact with others, and adapt or manage oneself. And here, information from a partner or family member can be particularly helpful, and also it's often very helpful to get a psychological evaluation. Remember, many people with severe head injuries have had other severe injuries and may have residual disability from those. Things like broken legs, broken arms that don't heal well, or amputations. All of those can add to a person's disability. Now, I'm not a psychologist or psychiatrist, and I don't do psychological evaluations, but often I'll do a few quick and simple tests of memory and thinking. And these tests, first of all, are orientation. Does the person know their name? Do they know the date, day, month, and year? And do they know where they are? Second, I give them 3 words to remember, and I set a timer for 5 minutes, and I see how many words they can remember. 3 is normal, 2 is questionable, 1 is impaired memory, and 0 is seriously impaired memory. I ask them to spell the word world forwards and backwards, which someone who's graduated elementary school should be able to do. And I ask them to draw a clock face with the numbers and set the hands at 10 minutes to 2. Now, finally, I'm going to talk briefly about something that will probably rile up some people quite a bit and get me in trouble. But I'm going to talk about it anyways because I have strong feelings about it. In the last 30 years, an industry milking supposed minor head injuries for cash has grown up in the United States. And I don't buy it. I've seen a lot of head injuries, both working in the ER, in a trauma center, and doing ringside medicine, where I see many people get knocked out, and I examine them within 10 to 15 seconds of them being knocked out. Since where I live, the rules are when a fighter's knocked out, the doctor is the first person into the ring or cage. I've now seen people complain of traumatic brain injuries who come into the emergency department with no loss of consciousness and not even a goose egg on their head, not even a bruised scalp. I think probably everybody watching this video at one time or another bumped their head and got a bruise, and probably you didn't injure your brain and your brain is working just fine. There is now an industry composed of lawyers, psychologists, and doctors, mostly neurologists, who will testify that anyone who's been in a minor fender bender has a serious and permanent brain injury from their head being whipped back and forth against the headrest at low speed. I've seen a lot of people with brain injuries, and I don't buy that you can get a brain injury from someone tapping the rear end of your car at low speed. I wish I'd kept the reference. I don't have it, but some years ago I read an interesting medical article looking at what happens to a person's head in low-speed accidents. And what they did was they put an accelerometer an instrument that measures the forces on the head in 3 dimensions on people, and they had them sit in a car, and then they would be rear-ended at low speed, and they also had them wear the accelerometer and perform normal activities of life. And what they found was the forces on the head and the brain from plopping down into a comfortable, well-padded chair were greater than the forces on the brain from a minor rear end fender bender. And I don't think everyone who's ever sat down in a comfortable chair has suffered brain damage. These people with these supposed head injuries routinely tell me that their memory and cognition or executive function are impaired. And I cringe when I hear that, because here's something people with real brain injuries do not say. I have never heard someone with a real brain injury say, my memory and cognition or my memory and executive function are impaired. So if you're offended by that, I'm sorry, consider yourself offended. And remember, if it happens, it's possible.